We got another episode of Intellectual Dummies. Today we're going to be talking about healthcare. Hopefully this is a little bit more of a nuanced conversation than just the typical fucking right or left narratives that we often see in our media. Because I think that's how they bank on nothing ever getting done, is being like, oh, it should be government controlled, or it should be, completely private, hopefully, we'll see what happens in this conversation, but I think we can all agree that the healthcare system's broken. Okay. And, we're going to talk a lot about this stuff because we've done a couple books for the book club. I know Alex works in human resources at a large waste company, and you deal a lot with signing people up for healthcare and stuff like that. And
right.
You've told me things that are just like egregiously fucked up, for lack of a better phrase. And again, with Intellectual Dummies, you can always count on whatever subject we're talking about. We've got at least a couple books underneath our belt. Either that or we're going to have people on that deal with it specifically, like Alex. That being said, we all agree that the healthcare system's fucked up. It's absolutely bullshit. And just a quick funny story that I was actually thinking about this last night. Back before I, really had a job on paper, and I was smoking a lot of pot, and I was a big Bernie guy. You remember when I was a big Bernie guy? From our last podcast. Alex is actually one of my co-hosts on our previous podcast, Brothers Banter. And at the beginning of that, I was a huge liberal, and I was I was a Bernie guy. I voted for Hillary Clinton. Yeah. I advocated for a complete government control of healthcare and stuff like that. Since I became more conservative and I started doing more research, things have moved towards the right, of course. But since I really started delving back in to this subject, at least in this particular subject, I'm kind of been swayed more towards the middle, where I don't think that the government should take over the entire marketplace. But there should be something that covers all. For lack of a better analogy, I think that we should have some type of basic cable coverage, because there's too much fucked up shit that's going on. But before we get into that, we're in Massachusetts. Every state has their own little fucking thing going on, right? You probably have more experience dealing with that than anybody else, just as far as from a company's standpoint. Having to provide healthcare. It's a law that you have to provide healthcare. Is that right?
Depending on the size of the company.
Yeah. So what's the size of the company? How does that work?
I think if you have, and I could be wrong about this, but I think it's if you have over 6 employees, you're required to have some sort of sponsorship plan, or there's a couple of ways to get around it: reimbursement plans, health savings accounts, stuff like that, I believe. But I think it's 6 or more, and you essentially have to have something. It's not super regulated. I'm sure that there's a million, 6, 7 landscaping companies out there, whatever industry it is, that don't use it, but that's kind of like the rule of thumb.
Okay.
And they have like different tranches of, 0 to 6 employees is this, 6 to, I don't know what the numbers are, maybe 25 to 50 to 1,000, stuff like that.
Yeah.
So they have all these different rules for it. But yeah, I mean, it's in Massachusetts we have Mass Health, and then Mass Health is actually a good program, and I wish that Obamacare kind of replicated that, but they kind of just fucked everything up, in my opinion.
Yeah.
But like you were saying about having kind of a basic coverage, healthcare is the only thing that I'm super conflicted about, because I'm a very small government guy.
Yeah.
But that Keynesian economic theory of pump a ton of money into the government and kind of prime the pump, and then everybody's going to be more prosperous. healthcare is one of those industries, like industries just like the military, where it's like you're not really going to get great results if you're not raising money on a massive scale. You know what I mean? Like you're not going to have bombers and missile protection, whatever it is. Same way you're not going to have sophisticated pharmaceutical patents in your country if you're not investing like literally tens of millions, hundreds of millions of dollars on these things. So it's tough because on one hand I'm like they shouldn't be in it at all, but then on the other hand I'm like, well, you probably wouldn't be able to have enough money invested in the healthcare system to create products that MS medications and diabetes medications and things like that. So I'm kind of in the middle on what the government should be allowed to do on it. Because like I said, on one hand, I don't want them involved in anything because they drive up the cost. But on the other hand, it's like healthcare is one of those things that is just inherently super expensive. You know what I mean? It's chemists and, you know what I mean? There's so much to it. There's trials, there's testing, there's a million things to it. So it does need a ton of money flooding into it.
And I mean, America is a very unhealthy country.
Yeah.
I mean, we're definitely more unhealthy than your average person. So a government-run thing is going to be very expensive at the very least in the beginning, because we're so unhealthy. We don't really have. I mean, think about our school lunches. School lunches growing up were like fucking. It was prison food.
Yeah.
It was literally tantamount to prison food.
Yeah.
I remember one time in Norwell High School. It was pizza day. Every Friday was pizza day. Remember that? And you either got cheese or pepperoni.
Yeah.
And I remember being like, I'm not really a big pepperoni guy, so I always got cheese. And you go up to the lunch lady, she asks you, I go, I'll take cheese. She goes, pepperoni? I go, cheese. She goes, pepperoni. And I was like, what? And she just leans over the counter and goes, the cheese is no good today. And I was like,
that's correct.
Because the lunch ladies liked me. They took a liking to me.
Yeah.
But they served all the other kids fucking cheese.
That's disgusting.
Yeah. So, but I mean, that being said, I've definitely moved more towards the center on that, because you think about, and Mike, I'll let you jump in here in a second.
No.
You think about, government run the two extremes. The two extremes. Government runs the entire marketplace, which stifles innovation. Nobody trusts the fucking government, and the list goes on, right? But at the same time, you get to the other extreme where it's just all private companies, and then you have private companies just gobbling up all the small guys like airlines and cable companies, and the same things happen at the two extremes, where the prices stay the same, the product doesn't really get any better significantly, and kind of everybody just gets fucked. Because when you go to an airline, how many airlines are there? Like fucking 5 that you would
domestically,
that you would consider flying on.
Yeah.
Right.
Cable companies. How many cable companies are there? There's Verizon, there's Comcast, and there even
Time Warner, I think.
Yeah.
Right? Time Warner.
So it's like, that's the other extreme where it's just the same shit happens, but it's all privately run as opposed to the government. So it's like, hopefully we can answer this question by the end of it, is there's something in the middle that we can have, and the media does a good job of tricking us into thinking it needs to be either or.
Agreed.
Yeah.
No, I mean, throughout my reading, the one thing I think that is... there's no question about is the amount of waste and fraud that just goes rampant in the healthcare industry. This is something you and me were talking about just a minute ago. Medicare, Medicaid, okay, government run. They're required to spend 98%. They spend anywhere between 96 and 98% of every dollar that they take in back on patient care. Private insurance, it's around 68 percent, and the rest of it is corporate salaries.
Yeah.
You know what I mean?
Right.
So, I mean, right there alone, you're talking a ton of money. I just want to read one thing. I'm just going to read this because when I happen to know a lot of nurses, medical professionals in general.
Yeah.
Don't ask me why, it's just a thing. And I messaged one of them that we were going to be doing this episode and asked her, in her professional opinion, she's an advanced nurse, very smart woman, what her thoughts were on medical and what I should maybe focus on. And this was her answer to me, so I just want to read this. The short version is there are massive amounts of money wasted and mistakes made due to the total lack of communication or accountability, compounded by arbitrary restrictions imposed by health insurance companies. Fat cats get fatter, sick people get sicker, and mediocrity is the norm. I'm in a unique position dealing with both inpatient and outpatient services, as well as insurance companies, and I'm watching the healthcare industry crumble around me. I think that's a very, very interesting statement,
Yeah.
and something has to change.
Yeah.
What's happening now is not working for anyone. You know?
Yeah.
And I was going to ask you, Alex, now, when you are looking at healthcare for your employees, you can't just call up Harvard Pilgrim
No.
or Blue Cross. You have to deal with a middleman, right?
Yeah.
Could you explain that a little
So
bit?
that's where, you know, on my side of things, it's tough because it's like we can all have our views on how medical treatment is, but the process of how everybody gets it, and this was the problem with, you know, the Affordable Care Act was supposed to, and sometimes I'm going to call it Obamacare, but I'm going to switch in between them, but they're the same thing. They pretty much set all these guidelines in that were supposed to, you know, save everybody from having no health insurance or being underinsured and all this bullshit, right? So what that did is it put a ton of the liability on the companies now, because it used to be you used to be able to just go and get your own health insurance. Some companies would provide it, some companies wouldn't, whatever it might be, changed across state lines, all these different things. What Obamacare essentially did was it created these restrictions. Like, let's say, for example, if you're a company that has X amount of employees, say 50 employees, and these are just kind of hypothetical numbers. They also might be accurate, but, you know, generally speaking, they'll say you're 35 employees, you're in this bracket, so you're only allowed to offer 2 plans, so up to 2 plans. So you can offer 1 plan or 2 plans. So typically you used to be able to have the opportunity to pick whatever plan you wanted. Now you work for a company and you can afford it. Perfect. You can't go into the free market anymore. You're subject to your employer, which gets rid of freedom of choice just completely. So now you can offer 2 plans in this instance, right? So we have 2 plans and you're just stuck with those 2 plans, and that's all that it is. And there's no negotiating from the employer end. So there's a couple of things that are broken about it. Is A, we can only have 2 plans, so we're already limited right there. I would love to have 10 plans. Even if there's only 1 person on each one, it really doesn't affect the admin side of things at all. You know what I mean? If they're all with Blue Cross Blue Shield and we're a part of 10 plans, that's totally fine. I can see our 2 plans the same way I could see 1 plan, the same way I could see 10 plans. So there's no extra cost to it. They just kind of arbitrarily limit it. And I think it's because they want big batches of people in these plans.
Yeah.
The other broken part of it is we aren't allowed to negotiate. So we need to have an agent, a health insurance agent. That health insurance agent, they're the ones that reach out to the United Healths, the Harvard Pilgrims, the Tufts, the whatevers. So they all have to have plans within our state. You know, there's a million companies out there, but they have to be Massachusetts in order for us to get pricing from them. So we're not allowed to negotiate. If I called United Health and I said, "Hey, you guys need to sharpen your pencil," they'll go, "Who is this? You're not even allowed to talk to us. We're not even allowed to talk to you about your rate."
Is that illegal?
It's not illegal, but they're not going to do anything for you.
Yeah.
You know what I mean?
Yeah.
Like it's gonna be all done through your agent. Like I couldn't call them and say, "Hey, I want to get better rates." They're gonna go, "Call your health agent." There's nothing.
Yeah.
You can't do anything.
Now that's a hindrance, right? I mean,
Yeah,
if
you need a licensed health agent.
But if there was no health
Right.
agent, and let's take that out of the process, out of curiosity, no
Yeah.
health agent, you're able to call these companies as an employer and say, "I have 50 guys that I need to get onto your books." Do you think it would be better for you if you could call them directly and say,
Yeah, 100%.
okay, so that's an entire section right there
Yeah.
that should just go away? Would you say, in your opinion, like?
Yeah, I think
Okay.
because it's one of these things where the idea of it is we're not going to put the onus on the company to learn about insurance plans, right? We're gonna mandate that every company needs to give these things out, right? So people are gonna go. You know, the original complaint when it first came out was, I don't know anything about health insurance. What the fuck am I going to do? I got to find health insurance for 50 of my employees, right? So it's like, oh, that makes sense. But the more we go down the road, the health insurance brokers, they're burn and churn. They go to a company. I mean, some of them are nice. Ours is actually pretty good, but for the most part, you need somebody at the company that needs to know the basics. You know what I mean? Like at the end of the day, I could send out an email to enroll people and all that stuff, but it might take a week. It might take a bunch of back and forth on questions. When at the end of the day, it's like, let me just learn how to do this. I'll enroll us through the portal and everything like that. So I can do everything once we pick a plan. And I do it just because it expedites things. You know, if somebody says, hey, I want health insurance starting on the 1st and it's the 16th, you know, if I'm going back and forth with the agent and I didn't know how to do it, it might take God knows how long. But at the end of the day, this person needs insurance.
Yeah.
So it's like the whole push was like, we'll install the brokers that will negotiate on your behalf. So people are kind of like, all right, whatever. Now, health and dental are kind of lumped into that same thing. So just to kind of speak to why I think it should be eliminated is whether there's a broker involved or not, somebody at your company is going to know about health insurance, how to enroll people. Even if they don't, they're going to learn it because they can't not learn it. It's
Well, that's
too
what
important,
human
I think.
resources is.
Right. Well, there's like benefits coordinators, human resources. But there's going to be somebody that's going to know something about it. They need to. You know what I mean? A broker's never going to do 100% of that work for your employees for you. They have 1 million customers. So one of the things that I handled for our company is like vision insurance. It's not regulated by the government. I call vision insurance providers directly. I can negotiate prices directly. I can pick plans directly. I can do all that stuff directly. No presentations, no nothing. Hey, I have this many employees. What's your best case? What's your worst case? And what's everything in between? I picked the plan. I did all the documentation. So the brokers do your documentation for you and you just sign.
Yeah.
I did it for the vision side of things. Fucking easy as pie. I told them that I wasn't a broker and we actually saved 10% on the company plan. So you're not allowed to do that with health insurance. It's obligated that you're going to have a broker. At least in this state. I mean, there's a million different rules, but we are not allowed to do that type of stuff.
So this is cutting off your choice too. This is cutting down your ability to haggle, as it were, or bargain the prices.
Yep.
And reducing your ability for choice because you're going through the broker and they're just trying to get you signed and moved on to the next customer.
Well, and that's the thing. That's another inherent problem with the broker model is the broker is they make commissions, right? So
Right.
United Health might pay 3% for a broker to sell a company's premium. So their monthly premium is what they're going to get paid on. I'm going to get 3% on this $50,000 a month account, right?
Yeah.
But Blue Cross Blue Shield might say we only pay 1.5%. So what's your broker going to pitch to you?
Right.
The more expensive plan.
Of course.
Yeah.
Of course. Yeah.
And so I've actually had to switch, like I said, it's not something that I wanted to know at all. You know what I mean? We're fucking a truck driving company. I don't want to know about half this shit. I'm hoping that these brokers are going to take care of it. So, we had switched a couple of times, and sometimes you get a good faith broker, which we ended up finding, and I just asked him straight up, like, hey, I just have this feeling that our last broker was just pushing the highest commission products on us. And then I said, before you say anything, please let me know if these are the 3 highest commission products out there. And I named all 3 of them, and she goes, I can't say for certain because everybody negotiates different pricing, but those are typically the 3 highest.
Wow.
And those were always the ones that were getting pitched to us. So it's like, I might see the Tufts plan, but it might be like, oh yeah, here's the Tufts plan, but that's, don't go with the Tufts plan. You know what I mean? And it's like, you don't want them to go with it because you make less money. So there's that inherent or an incentive for people to sell you on the plans that are the highest commission, and they might not be the best plans.
Yeah, because they're not in the market for them to make less money.
Exactly.
Why would you do that if you're middlemaning a product?
Right.
I'm getting 3% on this thing that's $100 or $50.
Right.
I'm pushing the hundo all day.
Exactly. And that's what was always happening is like, And the thing too with the higher commission products is they're always more. They essentially push the admin side onto the employer. You know what I mean? Where they're like, what you're going to do is you're just every time your employee gets sick, they're going to call this number, and this number is going to direct them to this place, and then that place is going to give them this rate. And they're just going to follow up. And they're going to get a reimbursement check. And I'm like, listen, give me a fucking card. Let a guy walk in. $25 deductible. That's what we want. You know what I mean? And so it's broken in that way where you're required to have a broker. It's non-competitive. And so one of the workarounds that should be available is I don't like my broker. I don't like the pricing they gave. That broker's fired, right?
Yeah.
Let me get a better broker so they can put out the pricing. No matter what broker's handling it, once your pricing goes out for that plan year, it's locked in. So if a shit broker, and this is I'm going off on a tangent of how I think it's just unethical.
Yeah.
Let's say our plan is up January 1, right? Let's just say it's right at the beginning of the year, our plan renews. If I have a shitty broker that I don't like, typically they'll reach out to you 60 days in advance, 60 to 90 days. If you have a shitty, unethical broker, they'll put out your pricing 4 months in advance, 120 days in advance. Because guess what? They just locked in your pricing. So if I say you're fired, I'm going with a different broker, that broker's going to go, your pricing already got sent to the market. Like because there's company
That's
essentially
insane.
social security, so it's like an ID number. So it's like a social security number for your company.
Right, sure,
That's already out in the healthcare market now. You already got your pricing from United. I don't give a shit if you have a new broker.
Wow.
You know what I mean? So it's like that's another tricky thing that happens is like I could say, you know what, I don't like the way that they've been doing business, whatever, fired, perfect. You would think that the way to kind of remain competitive is by saying, you know what, let me go with one of the big guys. I'm going to go with one of the biggest brokers out there. They have more leverage. They have more everything. Well, guess what? Your price is locked in.
Wow.
So you're literally handcuffed. It's almost like here's your price. And you're like, that price seems kind of high. And they're like, are you going to sign this or are you not going to sign? You know what I mean? Like it's like that's how it is.
Wow.
And it really leaves us handcuffed and just uncompetitive where we really can't do anything about it.
Let me ask you this. Do you find that those higher priced insurance options that you get from the broker, the one where they're getting paid the most, for example, would you find that those are also the ones that offer the least to the employee?
Yes. Well, and that's what it is essentially the reason it's cheaper. Well, let's start here. The reason health insurance is so expensive is not because of health care. It's because of the admin side, the documentation side, the payroll side, the regulation side, and the legal side. You know what I mean? It's like Tylenol's Tylenol. Tylenol's been Tylenol. But when you go to the hospital and you take Tylenol, they'll charge you $800 for it.
Right.
You know what I mean?
Right.
And the reason
That's
they
a great
do it
point,
is
yeah.
because the receptionist just logged everything into their system that costs them fucking $1 million a month to run. Her payroll costs. And then you go to the nurse. They hook you up to all the fucking machines because that's the requirement before they give you anything. So before you get any medical attention, you're incurring whatever it is, thousands of dollars worth of stuff. And now it's like, all right, you finally got there. The nurse logs everything in. Then they put a recommendation into the doctor. The doctor's going to come in and say whatever. And then the nurse is going to come back in with the Tylenol. So at that point, it's like hours of time between the reception, the nurse, to the doctor, back to the nurse, plus the medication. And this is just to get a fucking Tylenol.
Yeah.
So it's just, those costs are not, that's not healthcare. The healthcare is the fucking administration of the Tylenol. You know what I mean? Here's your Tylenol. That's what's going to help that I'm in there for this. They need Tylenol. The Tylenol costs this much, but it costs this much. It costs them 10 times that just to administer that Tylenol to that person.
Wow.
So it's what they do with the cheaper health insurance is they're essentially trying to pass off that administrative cost. So that's more of like a hospital situation.
Okay.
But like the administrative cost of you know how there's like in-network and out-of-network?
Absolutely, yep.
So essentially what they'll do is they'll say everything's out of network. We don't negotiate any rates with anybody. And that's why we're so cheap. But when you do have an issue, you need to call fucking 1-800 Joe Schmo's new health insurance company, and then they'll start calling around for the rate. So instead of them doing it beforehand, they start doing it as it happens. And because you're the one that's kind of on the hook wasting your time with one other person, it's cheaper than a sales team or a procurement team to get these rates from these people.
I mean, it just seems to me like when you're talking about like the administrative side and everything else and all these people, sales team, can we if we were to wipe that all out, wouldn't that drive down the price of the healthcare?
Well, so that's where, and I bring it up all the time and I wish I could say it like in company meetings, because health insurance is just too fucking expensive.
Yeah.
Everybody agrees on it. Nobody says, I think health insurance is perfect right now. You know what I mean? Nobody's like, hey, the price point seems good.
The only people that say that are people that don't pay taxes.
Right.
They're all the fucking liberals in college that don't pay
Yeah.
for their own insurance because they're under 26.
Exactly. And they think
And I'll put myself in that category because, like I said, I was a Bernie guy.
Yeah.
I was like, yeah, dude, everyone should have universal health care. And then as soon as I started working, I got my paycheck, I go, well, what is this, $600 a month?
Yeah.
What?
Yeah, it's insane.
You know, it's fucking insane.
Well, it's not just that, right? It's also, I mean, that's just your premiums to the employer, but you have your deductibles, your yearly deductibles.
Right.
You know what I mean? So an average blue collar guy or family, despite having health insurance and health coverage, can still pay tens of thousands of dollars a year
Right.
out of pocket. One of the things in one of the books I've been listening to, An American Sickness, is how there was a family used as an example that had really planned out their pregnancy at a hospital and to give birth and everything else. They planned out how much it was going to cost, had everything ready to go. But it just so happened that what they didn't know was that they were going to get an out-of-network anesthesiologist,
Right.
and then they get a bill from the anesthesiologist for an extra $10,000
Yeah.
out of nowhere.
Right.
So it's broken, man. Like, and how
Yeah.
I don't even know. I'm not a smart enough person to say how I think it should be fixed, or yes, the government should come in and do this or that, or no. But I do know that we have in the industrialized world the shortest life expectancy,
Yeah.
the highest cost for insurance, and I mean in the world.
Right.
So what are we doing so wrong that other countries are getting right? And it's not as if every other country above us has government takeover of healthcare.
Right.
I'm not saying that's the answer here, but where do we start, in your opinion?
So, and this is where, and it's one of those things where people think I'm, just being a Republican or just being like a fucking MAGA guy or something like that. But I always bring up, do you remember the State of the Union address at the very end? Trump was like, we're going to be the party for education, we're going to be the party for low taxes, and we're going to be the party, we are the party of education, we are the party of family, we are the party of healthcare. And when he said that, Nancy Pelosi ripped up the State of the Union, you remember
Yeah,
that?
that fucking bitch, yeah.
So when he said that they were the party of healthcare, at first I'm like, all right, he's just kind of trolling. You know what I
Yeah.
mean? Because it's like, you're kind of led to believe, well, the Affordable Care Act, that was the biggest thing that has ever happened. That was the biggest healthcare reform that was supposed to help this country and blah, blah, blah. Now, Donald Trump, in his Tax Cuts and Job Act, when they did the 2016 tax bill that they passed, part of that tax bill was rescinding the original mandate. So you used to get fined if you didn't have health insurance.
You're still doing
Yeah.
mass.
You do in mass because of mass health. So
Yeah.
across the
Yeah.
country, they essentially had that rule where if you didn't have health insurance, you got fined.
Right.
So, that's fucking crazy. That's
Yeah.
crazy to do. You're punishing people for having their own
Yeah, for
freedom of choice.
not having enough money in some
Right.
cases, too.
Yeah,
True,
and some
yeah.
people, it's like their thing is like, all right, well, I don't really, a 22-year-old in fucking Texas that works an office job is going, I'm not going to spend $800 on health insurance. I'm just going to save it. And they go, fine, don't pay for health insurance, but I'm going to fine you $200. And he's like, well, I guess it's cheaper than $800.
Right.
So it's almost like that is the definition of extortion when you really think
Yeah,
about it. It's
yeah.
like, I don't want it. They're like, you don't have to have it if you give me 10%. And you're like,
Right.
I'm still paying them? It's
Yeah,
like,
yeah.
You're paying no matter what. But
Right. So the idea that, not to cut you off, so then the idea that was behind that, at least what we were told, was that it forces more people into the marketplace, drives the price down.
Right.
But what you're saying is that that was not what really wound up happening.
Well, and that's what's crazy. So with him getting rid of the original mandate, so yeah, the whole purpose of it was, it's the same thing they're doing right now with job creation. Is they're going, well, more people are insured now than ever. People that never had health insurance, and you're like, half those people didn't want health insurance. That's why they didn't fucking. If you wanted health insurance in this country, you could get it. There was plenty of government subsidies before the Affordable Care Act that would get it, especially on the state level. So it's like, you mandating it just stopped. Like I said, it's not the fucking 70-year-old guy without health insurance. He's on fucking health insurance. We have Medicare. You know what I mean? Like that's taken care of. So it's like when they're like, we enrolled all these people. It's like you forcibly, you know what I mean? Like if they said we're gonna fine everybody in this country if you don't buy Ford vehicles, and then they go, see, Ford vehicles are the best. They just went up 50% sales, and it's like it's not the best. I have to buy it,
Right.
Or I'm very incentivized to buy it. But the other thing that he did with that bill with the Tax Cuts and Job Act was he introduced a thing called ICHRA, which is an individualized healthcare plan. So the reason I actually like Mass Health, and Mass Health was kind of the micro version of Obamacare, was, let's say I had a job and I was at one of those employers that didn't have 6+ employees. So I don't have the option for healthcare through my employer. You can go through Mass Health and you could pick, hey, I want Harvard. You have all the options. I could pick every plan in the state. And I can see every option. I can pick the deductible I want. You could do whatever the fuck you want. Almost kind of like car insurance. Like, you're required to have car insurance, but at the end of the day, I could go, I want no deductible, I want 500, 1,000, 2,000, I want no collision. You can customize it.
Yeah, pick your level. Yeah.
So you can do that in the Mass Health portal. And it's kind of what you could do on the Affordable Care Act portal. What ICHRA did was it essentially allows everybody to do that. So now you can have a plan where your employees aren't subject to just those two plans now. Now what a company can do is say, hey, you know what? We're going to go with ICHRA. Instead of having two plans, we're going to give everybody, call it $100 a week or $400 a month. And that's what you're going to get in your paycheck for, call it a health insurance stipend. It's not technically called that, but they use a ton of different terminology, but let's just call it a reimbursement technically. And now you can go on and pick Blue Cross, Tufts, United, Mass General, whatever it is. You have the freedom to choose what company you want, your deductibles, all that stuff, your price, everything. You could pick a plan that only costs you $400, and now your company's paying 100% of your health insurance. You could pick a plan that's 5 times that. Your company's only going to be covering a fifth of it because it's 5 times that. But that's if that's where you want to put your money, that's where you put your money. So it gives people that same freedom to kind of go into the competitive markets because companies can't. So it essentially allows the individual now to get into a competitive market.
Yeah.
So when he said that they're the party of healthcare, it's like that's what they've kind of been calling for forever, and he did it. And so it's like people can fucking hate Trump all they want. They can hate everything that he fucking did, but that was the biggest change in healthcare that you could possibly have.
A lot of people do talk about Obama, Affordable Care Act, let's call it, just to be technical, and pros and cons and stuff. I always thought that one of the pros with that, like for example, was like pre-existing conditions because, I mean, that was a huge problem. You know what I mean? You get cancer and now after that you're not able to buy health insurance. That's absolutely mental.
Right.
But I find it very interesting what you just said. Let me ask you this. As somebody who works for a small business in a very intimate way and you know it well, would you agree that the cost of healthcare, if let's just say you were to open your own small business with your own trucking company with 6 drivers, would you say that the cost of healthcare is going to be something that might even actually prohibit you from doing that or cause you to step back and say, you know what, maybe this isn't worth it because of this cost alone?
Well, so it definitely is a massive factor. It's definitely, I mean, it's something that's always going to be ongoing no matter whether you have 6 employees or 1,000 employees. there's always a situation of how many dollars and cents do we allocate towards pay and how much do we allocate towards benefits? And there's industries that are very, very benefits driven. You know what I mean? Like school teachers, for instance. Everybody says that they don't get paid enough. But when you look at their benefits package, you go, holy shit. So it's like the total compensation package of a teacher is fucking insane. But if they're let's call it their effective hourly rate might be $90 an hour, but they might only be taking home 28 of it. You
Right.
know what
No,
I mean?
I know exactly what you're saying.
So
yeah.
it's like, you know, in a lot of small businesses, it's the opposite because it's hard to remain competitive against the big guys without having people take home a bunch of money in their pocket. But the back end of it is listen, you can't be getting paid, you know, 85% of your effective rate and getting 80% of your health insurance taken care of. You know what I mean? And the big companies do it the other way around. So it's tough to find that middle ground of it. But it is a factor where it's like, you know, if you're a local trash company, you're never going to compete with Republican Waste Management's. You know what I mean?
Yeah.
Like the big corporate traded national, multinational companies, you're never going to compete with their benefits packages ever. So it's like the best thing you can do is just pay the person more money and just say, hey, here's more money so you can put it towards whatever you need it to be. And at the end of the day, that should be the best sentiment. And I think it's always the solution of like, if you're an employer and you're responsible for all your employees, it's like, I think that the best philosophy is here's more money instead of here's more of, oh, well, because you ever seen that movie, is it Head of State with Chris Rock where he becomes the president and he talks about in case shit?
Oh,
And there's insurance and he goes, insurance is in case shit.
that's
Right.
the movie
Case
where
shit
he
happens.
dies and he's in that other old guy's body.
Is it? Oh, yeah, I forget what
Down
it's
to
called.
Earth.
Down to Earth.
Yeah.
And he goes, it's in case shit. And it's the most true thing ever because insurance is a massive, massive cost. But guess what? I didn't go to the doctors last year. I still paid fucking whatever it was, $200-something a week for my family plan.
Right.
And I didn't go. Do I get anything for it? Nothing.
Right.
No, you just
So it's
keep
literally
paying.
in case shit happens. So it's like, it's such a massive cost that affects so many people, and it should be up to the individuals and not them being a slave to a mass health, an Obamacare, or even the employer side of things.
Yeah.
It should just be, hey, part of your benefits package is you get to pick your whatever health insurance plan works best for you, your family, even if you don't want it. But even if you don't want it, we give you $150 a week.
Yeah.
You know,
So I guess one of my, this isn't so much a question, I'll open this up to both of you guys and see what you both think. When we talk about, just for example, let's talk about senators, those in the, you know, those in the House and everything, elected leaders, especially federally, the health insurance benefits they get, right? I mean, they don't pay anything.
yeah.
It's subsidized by who?
Yeah.
Right.
Us,
The three
yeah,
of us.
yeah.
And it covers their families, it covers them, even after they're out of office, it's like a lifetime thing. So, why is it? And they see the best of the best. They're not seeing Dr. Nick from The Simpsons. You know what I
right,
mean? They're
yeah,
seeing,
exactly.
They're seeing the best, you know, doctors
Right.
in the world.
fucking Celtics doctor.
Right, exactly,
Yeah, you know,
exactly. So, if we're able to subsidize their health care, keep in mind these are the same people voting on what we're allowed to do.
Right.
If we're able to subsidize them and their families for life, essentially, isn't there room to be able to do that for everybody else? And that's and again, I'm not talking about government takeover here. I want to make
Right.
that clear.
Yeah.
But I mean, we pay. When you look at let me rephrase this. When you look at the things that our money goes to in taxes, it's just asinine.
Yeah.
Right. Why can't some of that be reallocated to like the most important issue for everyone,
Right.
which is being able to go see a doctor and not be sick? So I mean, what are your thoughts there? And
Yeah,
I'll leave
well, you know, I've mentioned it when we talk on the phone. If you break your arm, it shouldn't cost $10,000.
that. Right.
You know, like I said, there needs to be some type of basic cable package where the government is at least in the marketplace to compete with the private companies, because one of the books we read, I forget what it was called, The Price We Pay.
Yes. Yeah,
They were
great.
talking about, you know, when you mandate healthcare like that, and now everyone has to have healthcare. Of course, the prices go up, just like with the college tuitions and stuff. College tuition goes through the roof because everyone's got a guaranteed loan.
Right.
You know, so same concept. The price is going to go up for healthcare. Now, when the price goes up for healthcare because insurance companies are fucking covering it, the people that don't have healthcare still have to pay that inflated price because that's the fucking price now.
Right.
So now if you don't have healthcare and you're paying $10,000 for something that should be maybe a couple $100. Like that, they brought up a story about this one, and not to mention the insane price gouging. It's fucking. To me, it's insane that what are the leaders of hospitals called? What's the guy at the top of the hospital? What's he called?
CEO.
Yeah, the CEO. The fact that he knows what's going on and he's price gouging to not only in an immoral but sometimes criminal way. The fact that you're wired where you're just you're putting these people in the poorhouse, sick people in the poorhouse, is fucking. It's an insane thing. Now there was this one story about this guy from, I think he was from Canada, and he slipped in America and hurt his hip. He went to the hospital, and the CEO of the hospital was like, "Oh, you didn't have insurance in America. Oh, we'll do this for. I'm just gonna throw out numbers, but this was pretty much how the story went. We'll do it for $100,000." And the guy was like, "Well, for that money, I'm just gonna fly back to fucking Canada and get it done for whatever it is, way less."
Right.
And then the CFO was like, "All right, 50."
Right.
And then the guy was like, "What?"
Yeah.
And then this guy was like, 25. You do it for 25?
Right.
And it's like, wait, what's happening right now?
Right.
Yeah.
What's happening right now? Where, the price versus the amount of labor that's going in there, how much profit are they fucking raking in?
Well,
which
whole
is
lot.
fucking insane. I almost think it should be. So a part of me thinks that a lot of this stuff shouldn't even be profit fucking driven.
Well, that's the whole
You
thing.
know?
It's a profit-driven thing.
Yeah.
And it's a great example was hospitals, for example, non-profit hospitals. Okay, they can't show profit. So after their CEOs, CFOs, and all these other people are paid off, if there's money left over, it's put into the hospital. But into ridiculous things. We're not talking about patient care. There's an example of a hospital that what the CEO did was hire the same guy that modeled all the Hilton hotels to come in, remodel the hospital. So now all the rooms are single patient rooms, okay? Which obviously skyrockets the cost.
Right.
Because you can only have so many patients, right? And they had a concierge service, like an actual concierge service, so that the patient goes in, they have somebody that follows them around. Okay, now we're gonna go here. Now we're gonna do this. It's $100,000 a year paying job. Who the fuck needs that?
Yeah.
You know what I
Yeah.
mean? Bring back 4 patients in a room. I don't give a shit. It's an incredible amount of waste.
Yeah, it's a
An
bunch of
incredible amount of waste.
and it's all self-dealing bullshit because it's like, those rumors where they're like, at the end of the budget year, Congress has lobster dinners with all that stuff because they need to spend all the money and blah blah blah. It might not be that egregious,
Right.
But that's exactly what it is. Where it's there's a reason you see fucking Sheila Jackson from fucking Texas flying first class and booting people back into coach. Because she needs to spend that fucking money because her stipend to be a functioning member of Congress costs this much money. And those are reimbursable expenses. So it's the same thing. Healthcare is this big self-dealing thing, and it happens in all the industries that the government takes over because all right, why is the CEO driving up these prices? CEO is driving up these prices because the pharmaceutical company is going to go, if you want to carry fucking, this whatever in your hospital, it costs this much money. And that's just what it is. If you don't want to pay it, you don't do it. You know what I mean? And then they're going to file for grants for the government to be able to afford these things. The government's going to give the grant money to the pharmaceutical industries that are selling the drugs. And the admin costs are so fucking expensive because guess what? All the people that just went to fucking school to become doctors and nurses, that's also regulated by the government. So it's all this one big self-dealing expensive thing that it's tough because you don't want the government involved in it, but then it gets to the point of like, who's going to regulate it?
Right.
You know, and it turns into like that, like Vladimir Lenin said, the whom speech, like who directs whom. And it's like you want the government to be able to steer us in that way of like, we need to have cheaper healthcare. And that's what the sentiment always is. Affordable care. It's affordable care. It got more expensive year over year than it ever has.
Yeah.
Under the affordable. It's called the Affordable fucking Care Act, and it's never been more expensive. So it's like that whom thing where it's like, oh, they should be directing us on healthcare.
Yeah.
And it fails. But it's like, the problem is like, how do we direct it ourselves?
Yeah.
How do you do it without being a fucking doctor, without being a chemist that can make, you know, multiple sclerosis medication? You know what I mean? Like, how do you do it? So it's like, it's almost like it's like this, that too big to fail thing. There's too much going on.
Well, that's exactly right. One of the things in the American Sickness book that I've been listening to, and like I said, I think we have to do another episode on this at some point.
Yeah.
But one of the things that they talk about is just, it's almost like you have to take an axe to the entire thing.
Right.
Because you try and piecemeal it, as it were, and fix this. Okay, we'll patch this. It's just it's really a complex system.
Right.
But in the end, it's not so complex. It's just people making money hand over fist.
Right.
I go back to that statement from the nurse that I got, and I think it really hits it on the head. You know, I mean, the rich get richer and the sick get sicker.
Yeah.
And this is, I mean, let's be honest, this is the United States. You know what I mean? We take pride in everything we do, and we're at the top of the world in so many things except this.
Yeah.
And I don't know, you know, whether it's pharmaceutical costs or the gouging of that. Remember that asshole Martin Shahir, or whatever his
Shkreli,
name,
yeah.
or whatever
Yeah.
it is, you know, that asshole that brought the insulin and then was trying the rights to insulin and then was trying to charge. I mean, but it actually was a great example of what's wrong, I think, with this system, is that somebody was able to actually go and do that.
Right.
You know, I mean, where do you start?
And that's the thing is that there's always going to be the fall man of like this grandiose, like, look at this asshole.
Right.
And it's like, that guy's, at the end of the day, that guy fucking,
Well, no,
he doesn't
genius.
set pricing. You know what I mean? Like at the end of the day, he's like, he was pretty much the fall guy.
Yeah, agreed.
And I mean, he was an asshole, but at the end of the day, it's like, it's not like that guy was like, this is it. That's what this medication costs across the country now. You know what I mean? It's like, so he ended up going through all this stuff and being the fall guy, but pricing never fucking went back down.
Right.
You know what I mean? Like
Right.
nothing
Well,
ended up
remember,
getting fixed.
Once it seems to hit that plateau, it's not going to go back down under it. It's only going to go up. You know
Right.
what I mean? It's,
Yeah.
It's like fucking airlines, like he was talking about. You know, you used to be able to check your bags and bring on a carry-on until someday some asshole was like, "Hey, you can charge $50 a bag for that."
Right.
You know what I mean? Or $75 a bag.
Yeah, no more meals.
Yeah.
Yeah,
no
I
more
remember we
meals.
used to eat meals. They used to give a meal. Now they're like, here's a fucking shitty bag of peanuts.
Yeah, and they give it to you with a slingshot.
Yeah.
You know what I mean?
Well, and that's what it is too. Is that's another industry that just got absolutely murdered by the insurance industry. Insurance is, you used to see, and I forget what class I was in, but the professor said, you know, his generation, all the biggest skyscrapers in all the cities across the country would say, you know, Bank of America or J.P. Morgan Chase. You know what I mean? Like they would say, or J.P. Morgan. They'd be banks. Mm-hmm. That's who had the most money. Mm-hmm. Now all the biggest skyscrapers you see and the most grandiose buildings are all insurance companies.
Yeah.
They're all
Well,
fucking
that's a great
insurance companies
point.
because they make the most money off of all this bullshit. And it's like, back to the admin cost thing. And I always give this as an example with politics, right? They'll pass a bill, for example. Ebola is a perfect example. We were never affected by Ebola.
Yeah.
Remember one guy came over on a plane and what they do? They put $500 million in a bank account.
Yeah.
Guess what? That bank account is underneath a committee for Ebola. You know what I mean? They passed a bill. You can't just put $500 million into a bank account without it being subject to the finance committee, the House Oversight Committee. So it's like, it's always going to be a line item. It's always going to have a bookkeeper tied to it. It's always going to have an admin team tied to it. And who the fuck do you think it is? It's the same thing with political campaigns. I'm going to run a political campaign. all of my donations are just going to go towards my political campaign. None of it's going to go in my pocket. Okay, perfect. Who's running your campaign? Your wife? What's she getting paid?
Yeah.
It's not going in your pocket, but your wife makes $125,000 a year now. And your sister is the fucking billing person who fucking licks envelopes for $80,000 a year. So it's like, okay, your whole family makes $500,000 a year collectively now because you decided to campaign. You don't make a fuck. I didn't make shit. I'm running for president.
Yeah.
But my wife's got a book deal, and this person's my marketer, and that person's my driver, and it's like your whole family. You know what I mean? It's,
Yeah, like Nancy Pelosi's husband just so happens to be the best fucking stock trader in like the whole fucking world, right?
Right.
It's like, oh, weird coincidence.
Yeah, he's better than Warren Buffett and fucking Charlie Munger, but Well, and it's all that self-dealing shit, and it happens. I mean, with healthcare and education is the most egregious that it is. You know, and it's like.
But why? Why is it just here, do you think?
That's a good question.
And I mean, I'm not expecting an answer either because it's a huge question.
Yeah.
Because it's like, okay, you know.
Well, I think so. You know, Will Durant, who's a philosopher and historian, has said like a country's biggest strength is oftentimes its biggest weakness, and the capitalism. Biggest strength, it's one of the best systems we've ever created, but when it goes so unregulated and things get so fucked up, this is what happens, where people just, they can't get enough money. Because, I mean, let's get real. When you get I watched this study where it's like when you get a paycheck, you get a little dopamine hit.
Right.
And now I think it's like now you're making over $100,000 a year, you get a fucking dope, you know, it's just like, and it's like a drug, and I think they equated it to the dopamine hit of like cocaine, you know, and now you're a fucking CEO of a hospital and you're like, dude, 1,000% profit margins, fucking, that's fucking insane, you know, like you can't stop, you fucking can't stop, and unfortunately that's where we're at. There was another story about in the book that we did for the book club, where this woman, something was going on with her nasal passages going down, and what you do is you have a nurse like stick a balloon in there, and they inflate the balloon and just, you know, it fixes the air passage. $25,000.
Right.
And then like after insurance, it was still like $9,000, and the woman thought she made out like a bandit because she's looking at those numbers. Oh wow, I just saved all this money.
Right.
When it's like, dude, it took a nurse 15 minutes.
Right.
That's fucking 15 minutes of labor.
Right.
Plus the 15 minutes to charge for the room. That should have been maybe $200.
Right.
With equipment and everything.
Yeah.
But the insurance just the insane price gouging in this country, and unfortunately the whole, and I want to call it the what is it when people come to the American dream where you can make as much money as you can, like our biggest strength, but at the same time in these situations that's the industry's biggest weakness, is that price gouging, you know.
One of the things I found fascinating, the first health insurance company in this country was Blue Cross Blue Shield, and they were based out of Texas. And I believe it was in the 50s, maybe slightly before the 50s, after World War II, that they came into being. And it would cost people $5 for the health insurance. And the health insurance was only to cover major hospital events.
Right.
Okay, people didn't pay to go see doctors. I mean, didn't have insurance for doctors because it was like $1. You know what I mean? $2. Of course, we're going back a long time.
Yeah.
But that $5 that people were paying for health insurance to cover them in case of something catastrophic, equated to today's money is only $100. $100.
Right.
And it's costing us that, you know, it's costing double that per week.
Right.
You know what I mean?
With your employer matching 50%, so it's fucking, yeah, exactly.
So, I mean, you
Double
know.
it again.
Yeah. So, I mean, it's insane.
With a fucking massive deductible. And,
massive deductible, yeah.
well, and that's what it is they made it, and I say it about attorneys all the time, is attorneys essentially created a language to corner a market. You know what I mean? Like, at the end of the day, it's like, I could express the same fucking thing, but you know what? I don't know the fucking, you know, terminology to represent myself in court. You know what I
Right.
mean? Like,
Well, that's a great
if I wanted to
point.
defend myself, I'd be in prison right now just because it's like, oh, you didn't say this little fucking Latin phrase before you said that, so you incriminated yourself.
Right.
Like, I'm going to prison because I said the same thing my attorney said, but he said fucking
Right.
off the record, but
Right.
in Latin
Yeah, yeah.
first. You know what I mean?
Right, right.
And it's the same thing with healthcare now. Is the sheets that I get in healthcare? They've even now it's like there used to be like just deductible used to be the only fucking thing, right? Now it's like, all right, here's my deductible, here's my copay. Now here's your deductible, your copay, your pharmacy copay is different, your pharmacy deductible is different, and now there's an out of pocket because your copay isn't part of your deductible. So if you have like a super high deductible plan that costs you $500 copay to go to, let's say you have a $2,000 deductible, but your plan has a $500 copay to go to the emergency room. So you go to the emergency room, you pay $500. It doesn't count towards your deductible.
Yeah.
So it's like, what the fuck? You know what I mean? Like my
Yeah.
deductible that's supposed to be like what your out of pocket is.
Yeah.
So when people started making that argument, now there's a separate thing where now it says deductible / out of pocket. So if your deductible is $4,000, your out of pocket is say $8,000 because you're going, wait, I'm paying way more than $4,000. That's my deductible. And they go, well, technically these things don't fall under your deductible. And you're like, well, then what the fuck is my deductible?
Right.
You know what I
Right.
mean? And it's
Yeah.
like they carve out these little things, and I don't know how, like, I don't know how to fix it. I don't know a good solution for it because I'm so anti-regulatory.
Right.
But I think, and I wrote this down one night when I was thinking about it, like I had this epiphany where if they treated it more like a social security, where if you didn't work your whole life, you don't get social security.
Right.
You just don't.
Right.
And then there's tiers to it, right? So
Right.
if you make, the highest level, you can get the highest amount of social security. If you wait till this time, you get this much and blah, blah, blah. So I think that healthcare just needs to be a thing where it's tied to that, where it's like, hey, if you're 20, if you're 18, 19, 20, whatever, and you think you don't need health insurance, fine. That's fine. But when you do decide you need health insurance when you're 35, now it's more expensive. You know what I mean?
Yeah.
That's interesting.
And it kind of fixes sort of the pre-existing condition thing where I think that there should be like that draw line of like, you're not going to pay for any pre-existing conditions if you have health insurance before the age of, call it 21. You're going to get standard, everybody has their standard rate of health insurance. And if you get it before you're 21, everything's fine. But if you decide, I'm going to save some fucking money, fine. Same way Social Security is. You don't want to work, that's fine. But don't expect a Social Security check when you retire because
Right.
you didn't fucking work. Same thing with health insurance. Like, hey, you want the benefits of having low-cost health insurance when you really, really need it when you're older and sick? Have it when you're younger. You know what I mean? So
Yeah.
you're kind of almost subsidizing yourself.
That's an interesting point.
Yeah.
Because it's hard to subsidize other people because it's just inherently unfair, for lack of a better word. Where it's like,
absolutely.
why the fuck am I paying for an 80-year-old cancer patient? It's like, it's a nice sentiment, but at the end of the day, you're like, why the fuck am I paying for it?
Right.
You know,
Yeah.
where it's like, you're paying for yourself to be an 80-year-old cancer patient instead if you start doing it while you're younger. So it's just one of those things where it's like, all right, you know what? Fine, I'll save the money for 10 fucking years and just hope for the best. But you're going to be paying more money when you're 30 to sign up for it.
Yeah.
That was the only, I mean, it's obviously a simple answer. There's a million
Yeah.
different
Right.
things you could probably insert
Right.
in there, but that to me was just kind of like, maybe that's the way to do it. Is just say, you have to have it at this point. If you don't want it now, you're going to get it later and it's going to be more expensive.
Do you feel that because a lot of other things in this country are carried by special interest groups, and obviously healthcare being, I think, probably one of the biggest, do you think that just because of the sheer amount of money that everybody makes in that industry, that it's just impossible to cut some of like this waste out, some of the fraud out? I mean, just the simple
Yeah.
things that we've already talked about, and that's just very simple stuff. We haven't even really gotten into the meat and potatoes of how much money is wasted in this industry.
Right.
Do you think it's impossible to get rid of just because there's too many people with too much fucking money? Too
Um,
much power?
Well, so this is where you need that, what is that guy from Argentina? That fucking
Yeah.
awesome
I forget what his name
libertarian
is.
there.
Yeah.
But you need somebody like that, and the problem is, like I said, fucking love it or hate it, but not to make it political. Donald Trump was one of those guys that was like, fuck you, fuck you, fuck you. But in this country, it's one of those things where, one of my favorite sayings as far as politics goes is the process is the punishment. Donald Trump doesn't need to go to jail. Or insert whatever politician. One politician goes, we're burning the healthcare industry to the ground and we're going to rebuild it back up and we're going to get rid of all this bullshit. Sued, impeached, charged with felonies. We're going to raid your house. We're going to seize your assets.
Yeah.
We're going to not let you do business in the city of New York because right now you're fucking, charged with felonies. And because you're charged with felonies, now you can't travel. You know what I mean? So it's like, you didn't even commit a crime yet, but you've already you're essentially imprisoned already. You're just not in an actual brick and mortar prison,
Right.
It's like, not to get too deep into fucking crazy shit like repercussions that happen to it, but you kind of saw it with somebody coming in and breaking the political system.
Yeah.
You know what I mean? Like, there's a reason he was so inflammatory, is because he kind of broke the political system of like, hey, these people are the Clinton Foundation was one of the biggest foundations in the fucking world. You call that shit out, guess what? We're going to sue you. You know what I mean? Like, you want to change the tax cuts and not pass it by the normal people? We're going to sue you. You know what I mean? Like, you want to call out the fact that members of Congress have family in these countries getting paid millions of dollars? We're going to impeach you. You know what I mean? And it's like, you get a guy like Argentina who goes in there and pulls all this shit down. They don't have that same, like, cudgel. You know what I mean? Like, the government is so big that, okay, healthcare already is too big of a beast to curb. Let's say I do want to curb it. Guess what? All the people that are invested in that are just as invested in this legal system or this court system or this financial system that will beat you down.
Right.
You know what I
right.
mean?
No,
So
that's a great point. Yeah.
Yeah, it's
Too much is connected.
Right,
Too
exactly.
much is connected. Yeah.
Right, exactly. So it's like I said, it's all this self-dealing stuff where it's like, you go into the healthcare industry and it's like, why are doctors so expensive? Well, they're so expensive because it costs so much to implement all the healthcare. Well, why does that cost so much? Well, because to get the degree to it, it costs this much money. Well, why does that cost so much money? You know what I mean? And it's like this big circle of like, how do you break this wheel?
Right.
You know what I mean? Like, you can't just, in order to get doctors to be cheaper, the pharmaceutical industry needs to be cheaper. And for both of those things to be cheaper, the education system needs to be cheaper.
8 years of college, and college is getting inflated, and that's a whole nother fucking can.
And in order for all three of those to be cheaper altogether, you got to get rid of all the administration and regulation imposed on them by the government. So it's like, in order to do that, it's like, all right, fire 80% of people at universities, get rid of half of Congress.
Yeah.
You know what I mean? Like, get rid of the government grants for the pharmaceutical industries and fire 20% of people at the hospitals.
Yeah.
Well, that's
it's like, it's crazy.
Well, I guess that's just the thing that drives me nuts is I don't know if people realize how much we are already, how much that industry is subsidized by us already.
Right.
Never mind through what we pay through insurance premiums, just through taxes.
Yeah.
How much money goes into the healthcare industry and we get nothing back for it.
Right.
Nothing.
Yeah.
For example, here's a prime example, something that I, again, was reading about. Residents. We all know what a resident is, right?
Yeah.
You go through your 8 years of school and you become a doctor. But in order to have any kind of specialty or anything like that, you have to go through a 4-year residency program. Residents are typically paid less than we are as truck drivers.
Yeah.
Under $100,000. They have to go through that 4 years. Well, their pay is subsidized by the government. A good portion of their pay is subsidized by the government. But an average resident on a yearly basis, so let's just say the resident all told makes around $90,000 a year, but a good portion of that money is paid by the government, and yet that resident can bring in $150,000, $200,000 a year into the hospital through services.
Oh, easily, yeah.
You know what I mean? That one resident. So we're paying for a good portion of his salary already. The hospital's making a huge profit. What are we getting back for that money that we're paying into the resident? Not saying that we shouldn't be, but what do we get back for that? Nothing, just higher cost, higher cost, higher cost.
Yeah.
So, I mean, we're already paying a ton of money in taxes into that healthcare industry and not seeing any return.
Right.
How do we fix it? I mean, come on.
Yeah.
You know what I mean?
Yeah.
Now, if I were to get a little bit abstract about it, because when I was doing my philosophy thing, I was reading a lot of Plato and stuff, and I know I had mentioned to you,
Yeah.
I don't know about you, but Plato was talking about, when he was talking about the corruption of politicians, he was just saying, make money not a factor. Make the people who make the decisions in this country, they just live in housing. They don't get paid. They just eat regular food, whatever. So that way when you come up, like, they can't use money. Money is
Right.
not a part of their life.
Right.
Right? So when you go up and be like, hey, I'll give you 10 grand to pass this bill, and like, this 10 grand means nothing because I live in this little 2-bedroom with my wife and kids, and
Right.
and that's it. So I think almost, like I said, pretty abstract idea. I'm just kind of putting it together right now. Is maybe make these hospitals kind of the same thing, where you just have people that get educated into the medicine. They're healers. They're just healers, doctors, whatever you want to call them. And you go there, they have a bed for you. Okay, what do you need? And fucking all that shit is subsidized and they use it, and money is not a factor, and fucking just, I don't know, go old school with it like that, I guess. Like I said, very abstract. It'll probably never happen, but, you know.
I just think a multi-billion-dollar a year industry should have more service for the people that are paying into that industry. You know what I mean?
Well, and it's crazy because it's turned out to be less service that you get out of it.
For more money.
The more money that's going
Yeah.
into it, and that's like, it's the voting with your dollar type of thing, where it's crazy because, like you were saying about the price gouging, it's like the simplest way to put our system is supply. Capitalism is the simplistic supply and demand. If the demand is very, very high, the cost is going to be very, very high.
Right.
And the supply is very, very low. So it's
Right.
like, as far as kidneys go, supply is very low, but if you're going to die if you don't get one, it's going to be super high. Now it's like, what's the price tag do you put on that?
Right.
But even on the simple stuff, it's like, and this might even be a totally different conversation of overdiagnosing psychosomatic people, where it's like,
Overdiagnosing. But go ahead.
right. So it's like, like I said, the admin cost is what's bringing up the healthcare cost more than anything. What's creating the admin costs? It's patients going in there. How do you bring that number up? Is you bring more patients in. How do you bring more patients in? Hey, if you have a migraine, go to the fucking hospital. Back in the day, that's not what you did. Back in the
Yeah.
day, you didn't go to the hospital if you had a pneumonia.
Right.
If you had a
Right.
broken finger or a broken toe, you just whatever.
Yeah.
Somebody could rip your ear off back in the day.
Right.
It's like, fuck, my ear is gone.
Yeah.
Like, that was your healthcare.
Put a Band-Aid
Yeah,
on.
get
Yeah.
the iron and just
Yeah.
fucking press it on my head.
Yeah.
And it's like, for real though, like, it's like, that's what it was 50, 60 years ago, where it's like, you weren't going to the hospital if you broke your toe, you broke your finger, you chopped your finger off. You know what I mean? Now it's like, you get a headache, you got a cold, you go in. And what's that doing? It's making, the guy that's in there with that did break his leg or has cancer or whatever, part of his cost is the cost of running this hospital, and part of the cost of running this hospital is dealing with fucking Sniffles McGee over here, who's told to go to the hospital because that's what you're supposed to do now. You know what I mean? Like,
Right.
oh, do you feel sad? Perfect. For a $15 copay, that's really a $30,000 medication bottle is what'll make you happy again.
Yeah,
you know what I mean?
yeah.
Like,
Right.
so it's almost one of those things where you almost just need to, like, it's crazy because healthcare isn't something you can step out of because everybody needs it at some
You
point.
have to have
Yeah.
it.
But it's
You have
almost
to.
like, shit, how do I feel like I should go to the hospital because I'm told to go to the hospital, but I know I'm going to be fine if I don't.
Right.
And it sounds
Yeah.
crazy, and it sounds like you're anti-healthcare when you say it, but it's like, even with kids, with newborn kids, it's like, oh, my kid's got a fever, my kid's whatever. And it's like, I go in there and I go, what are we going to do about this fever? Oh, we're going to give him Tylenol. I get Tylenol at home. You know what I mean? I got Tylenol at home for $8.
Yeah.
And then it's
Right.
like, what happens if the fever doesn't go down with the Tylenol? Well, then they'll have a seizure. Are we preventing the seizure, or are we just saying it's going to happen if the Tylenol doesn't work?
Yeah.
'Cause
Right.
not saying it's better to watch your kid have a fucking seizure at home than in a hospital room, but if you're not going to do anything there, at least we're in the comfort of our fucking home. So it's like, it really starts to get crazy of like, do you just step out of it and only go if you somebody slices you in half and you gotta fucking,
Yeah. Well, I mean, in the end, it doesn't matter because you're still paying the goddamn health insurance
Right,
costs.
that's
Yeah.
true.
You know what I mean?
That's true. That's very true.
So, you know, one of the things that I heard a lot about now are like these surgery centers that have been popping up all over the place. Something I never knew about before. But like vascular health, for example, these centers have popped up where, oh, are you having a leg cramp? Come on in, let's take a look at it. And then they'll do an ultrasound and say, oh, you know, it looks like you could have a blood clot, or it looks like your veins are having, let's do this procedure on you, you know what I mean? And it's a $25,000 procedure, and they never need it in the first fucking place.
Right.
Yeah.
That is a problem. The overdiagnosing is definitely, and
Yeah.
it cuts to greed.
Yeah.
It cuts to greed and
They're
price
right.
gouging and the whole thing.
They're incentivized to give you
Exactly.
everything.
That's it.
You know.
That's perfectly
They're like,
put.
we'll give you the ibuprofen just in case with the Tylenol. And
Right.
you're like, that's so you can make $1,200 off of two things. And-
Exactly.
You know what I mean?
Exactly. Doctors are incentivized to make certain diagnoses
Right.
or to do
Yeah.
certain procedures.
Right.
That's a problem.
Yeah,
That's a real.
absolutely.
That is a legitimate problem.
Yeah.
How do you cut that out? Why is
Yeah.
there and then? Why should a doctor be incentivized to do a procedure on someone that doesn't need it? Like it should be the opposite way. It should be like, hey, you figured out how to take care of that patient without doing that
Right.
procedure.
Right.
Fucking here's an extra $100 because you just
Right.
saved. You know what I mean?
Yeah.
Just as an example, you know what I
Yeah.
mean? I know at work, you know, driving a truck, if you're able to get the job done with less steps, that's a good thing.
Right.
You know what
Yeah,
I mean?
yeah,
exactly.
Like, so why is it the other way around in the medical field?
Right. They
You know.
incentivize the overcomplication over, you know, they want to make it more just, they want to inject it for, you know, not literally, but, you know, they want to
Yeah.
inject all those things into people's lives because that's their product.
Right.
Their product is healthcare. They want people to buy healthcare,
Right.
you know?
And to be able to charge.
Right.
You know what
Yeah.
I mean? Like,
Yeah.
I just know that something has to change at some point.
Yeah.
You
Yeah.
know, because it's so broken. It's so broken.
Yeah, people need to start getting educated on it instead of listening to the media. Being like, Republicans want to take away people when they want grandma to die. And
Right,
it's like,
right.
and then the Republicans are like, hey, communism! You know, and it's just
Right.
like, dude, fucking.
It is super polarized.
Yeah, exactly.
It's hard to not get. I don't know if you guys saw me smirking like 10 minutes ago, but it was just because I looked at my phone and I realized I haven't done a podcast in a long time about politics, and it only took me an hour to bring up the Clinton Foundation. So I get there usually it's the first 5 minutes. But no, but that's the thing is it's hard not to get caught up in the polarization and stuff like this.
Yeah.
It's really hard not to, and that's the fucking distraction.
They do it intentionally,
Yeah.
too. I
Yeah.
mean, that's intentional to get people to never come to the conclusion of, okay, we can all agree that the price gouging in the insurance is fucking insane. I shouldn't have to pay out of both ends. I shouldn't have to fucking pay health insurance and still pay out of pocket.
Right.
That's fucking insane. You shouldn't have to
Right.
pay out of both ends. It should
Right.
be one or the other.
Right.
Either my tax money is covering it or it fucking doesn't.
Right.
And you shouldn't put it on small businesses or large businesses unless large businesses want to. You shouldn't make them take over something that the government should be taking over. Should be at least helping out or regulating properly in the first place.
Well,
You know?
and I think that's where the ICRA thing I think will be a big help is because at the end of the day, if you really think about it, like every person that's employed, every single person that's employed is onboarded, and the first questions are compensation package,
Yeah.
which is health insurance, pay rate, health insurance, dental, all that stuff. And the wages, the retirements, the promotion, all that stuff is in the company's purview. Health insurance shouldn't be something that's in that because it's just not helpful. It's like the government came up with this plan to do it and they sucked at it. And then they were like, just put it on the employers. Now every employer is liable for this plan that we passed, and all the employers are like, what the fuck? You know what I mean? And it's a disservice to everybody. It's a disservice to the employer because they're going, I don't want this fucking burden. I'm not a health insurance person. And it's a disservice to the employees because they're like, my health insurance is now limited to fucking 2 to 3 plans.
Yeah.
And I don't get to pick my deductible. You don't get to pick shit. You know what I mean? And it's like, it's a complete disservice to fucking everybody. So I think that ICRA thing is, you know, hopefully that changes things.
When is that supposed to come into
So,
effect?
It's already kicked in.
Okay.
I don't know if it was last year or the year before, but that's part of the problem too. Is like then it turns into that whole process of like, well, the first year we only have the infrastructure to do it for companies that are 1,000 plus.
Of course.
So who gets the benefit first? The fucking Amazons and the WalMarts and
Right.
shit. And then it's like we'll eventually get to you guys 2-3 years down the road, or you could switch to some obscure broker that might handle it. That's you know what I mean. So it's tricky because, like I said, it's turned into this complicated language of like, not to get too deep into the nuance of it, but like, from my side of things, there's something called an HSA. There's a health savings account.
Right, yep.
Health savings account is a non-taxable. Think of it as like how your 401k, you can put it in and it lowers your taxable income.
Right.
Yeah.
So it lowers your taxable income. It grows tax-free. And then when you have a healthcare expense, you can withdraw it penalty-free. So you're not paying, it's essentially making healthcare tax deductible, which it should be in the first place. And you can pay healthcare deductions after you've had them invested, even in a money market account. You're not paying taxes on the gains or anything like that. So to me, it's like my best answer to it is doing HSA accounts. So essentially what it is, hey, pick a shitty healthcare plan that's got a super high deductible, but give people this much money in their HSA accounts. So like I said, it goes back to that in case shit. Hey, guess what? You don't use your health insurance that year? Fine. Your health savings account still exists. It's growing and it's being funded by the employer. So you still get to keep your money. It's not getting paid for in premiums, right?
Okay.
So like, all right, let's say for instance you pay $150 a week for health insurance. And I say, guess what? What we're going to do is we're going to get a really shitty plan, right? It's only going to cost you $50 a week. But I'm going to take that extra $100 and we're going to put it into a health savings account for you. Lowers your taxable income. It grows with the market, however you want to invest it. You can even just keep it as cash in the account. And if you want to pay, because now you have a shittier plan, so it's going to be more expensive. But guess what? It's more expensive, but you have an account specifically for that that's tax-free that you can use for it. And if you don't use any health insurance, guess what? You're still getting that $100 a week every week in your health care account.
Untaxed.
So it's like,
Yeah.
all right, perfect. I didn't use it at all. But instead of paying $150 in premiums, that's just gone. Now I have $5,200 in an account. That's factoring in no growth. So let's say you have a bad year the next year. Well, yeah, I have to pay more money, but now I have a $10,000 account that's employer funded.
Yeah.
That's kind of the cheat code for it, but the problem is the education side of it. You know what I mean? It's like there's a million tax loopholes that you can do, but if I ever told employees, 50 employees, hey, guess what? We're going to go with a shittier healthcare plan, but we're going to give you this much.
Yeah.
Half of them are just going to look at it like you're just giving a shittier healthcare.
Right,
Yeah,
right.
yeah.
But in
right. That's a
reality,
great
it's
point.
like it's the thing to do. But it's almost like when you see Shark Tank and you see this guy with an amazing product. Like, but how do you put it on a shelf?
Right.
Because on a
Yeah.
shelf, it's this fucking black box.
Right.
I didn't know it was going to cure cancer unless you got a guy there in a lab go and see this. All you know,
Yeah.
it's like it's an ongoing educational process. So it's like it's very industry specific. You know.
I gotta ask you a side question here. My last employer had an an HSA thing going on.
Yeah.
But they told me that if you didn't use it by the end of the year, you lose it. Is that not the case?
So when I was saying earlier, like when I was kind of treading lightly on the terminology of reimbursement and savings account and stuff like that, there's a bunch of different ones. So there's stipends,
Okay.
there's HSAs, health savings, then there's health reimbursement accounts.
Okay.
So a lot of people that use health reimbursement accounts will pretty much say like, we'll put $1,000 a year towards health reimbursement, co-pays, deductibles, whatever. We'll reimburse you if you give us the receipts. But if you don't use it, it doesn't carry over. Health savings account, and I'll double check all this stuff. I could be wrong, but if it's not this, there is a product like it. It might just be called something different.
Okay, fair enough.
Because there's like
Fair
a million
enough.
different names
Yeah,
for
I do,
Kind
yeah.
of like in retirement. There's 401k, there's Roths, there's IRAs, there's traditionals, there's SEPs, there's a fucking zillion different
Yeah,
things.
right.
Kind of the same thing with this, and I'm pretty sure it's a health savings account where it's just kind of your account. You could go to Schwab right now and open up an HSA account. You put $500 in there, it lowers your taxable income by $500. It grows to $700, and you do break your wrist and you got a $500 deductible. You can take that $500 out tax free. So on one end, you're lowering your taxable income, and you still get to use that tax free. So it's like, and you got $200 worth of growth out of it because
Right.
it was invested in that time.
Yeah,
So
yeah.
Okay.
it is like the hack, but it turns into like, it's easier to explain it to people. You know, in the healthcare industry, people will understand that no problem.
Yeah.
You know what I mean? Maybe in higher educated sectors, people will understand it better. But like I said, you go to a fucking landscaping company or a trucking company and try to explain it to people, they're just gonna go, "You just cut my fucking health insurance."
Right.
Unless you fucking have somebody sit there for a whole day and explain it to everybody.
Right.
And every time somebody's hired, you explain it to them, they're just gonna go, "You just have shit benefits."
Right.
But in reality, that to me is
Yeah.
a good answer, but who knows,
Well,
man.
they gotta teach that in schools, you know. I mean, instead of fucking reading the Scarlet Letter, how about you tell me about my fucking health
Yeah.
insurance and
Yeah.
you know shit like that, you know.
Well, they absolutely should. I took a class in high school that was the first year it was offered. It was when I was a senior. And I was either going to take, I think it was trigonometry or calculus, or it was called financial planning. And it was the first year that they did it. And we learned about opportunity costs, market growth, different types of investment accounts, budgeting. And it was like, I'm trying to think of a politically correct way to say it, but it was like a class that's like for the idiots. You know what I mean? Like, you know how there's like, oh, everybody's taking English, but you're taking reading.
Right.
You know what I mean?
Yeah,
It's
yeah,
like reading is for people that can't fucking write. That's what, you know what I mean?
Yeah.
Right.
And that's what this financial planning thing was. It definitely had this stigma of like, when you're a senior, you're supposed to be taking calculus, or even if you're a year behind, you're supposed to be taking trig. And it's like, I was like, fuck that.
Yeah.
I want to try this financial planning thing. And I learned so much in that class. And it's like, guess what? Never use trigonometry.
Yeah.
Yeah.
You know what I mean?
Yeah.
And
Yeah,
it's
good thing I spent a whole year learning about sine and tangent, fucking whatever. the
Right,
fuck.
Right.
yeah. Let me get my
Yeah.
graph. Hold on, let me get my graphing calculator for this conversation.
Yeah.
Never fucking happen.
Right.
It's never fucking happen.
Yeah. I actually haven't used a graphing calculator since high school. So
Right.
good thing I spent $100 on that.
Yeah, so it is stuff that people, you know, it's an education difference, but like I said, they don't want you to be educated in it because guess
Yeah,
what?
yeah.
The brokers get paid. If you're educated in it, brokers don't get paid.
Yeah.
Same thing with attorneys. If you
Yeah.
knew that fucking lingo, you would never hire an attorney to defend you.
Right.
Yeah.
So they've kind of turned it into that.
Yeah.
Sucked up.
Yeah, so.
Good basis here. I'll
Yeah,
tell you
no,
what.
that was good. That was good. You know, that's awesome. Well, yeah, so we'll end it there. We'll probably end up doing a part 2 because, I mean, we just fucking, you know, I mean, we're always fucking just reading books and listening to books.
Exactly.
I mean, fucking.
I feel like we're just scratching the surface with
Yeah.
it.
We really are. I mean,
You know?
there's a lot of stuff that we could touch upon, but we've already done about 4 hours of podcasting today.
Yeah, exactly. Yeah.
All that being said, like and subscribe, and that'll be that. Until next time.
All right, awesome.
Very good.
All right.